a majority of health clinics in the city of Tshwane are still open despite the Samwu strike there. Earlier in the week, there were fears that some clinics will be closed due to the intimidation of staff and patients. Let's get you an update on this now. Bring in Themba Fosi, who's Tshwane's Utilities MMC, joining us via our video link for more. MMC, it's lovely to have you on the program. Thanks very much indeed for speaking to us this Saturday afternoon. My understanding is that, yes, most clinics are open, but some, at least from a statement from yesterday, aren't. And that includes Littleton, Hercules, Karen Park and Roslyn clinics. Were they closed because of the strike?
Definitely. They were closed because of the strike and with intimidations from the union members who came to those clinics you just mentioned now and started pelting bins, throwing stuff around and all of that, which we condemn to the biggest extent, that these are facilities that are servicing our people, the elderly and our pregnant women who use these facilities which are closer to home for them to be able to access. So we condemn this in the strongest words.
Right. And what's the update around their operations this Saturday afternoon, sorry?
The update is that the services are ongoing. However, they are extremely delayed as a result of personnel not being available. We also want to extend thanks to those that are coming through to assist us, because there's quite a number of our own employees who are coming to work, which are risking their lives because they're being intimidated. Some are even hurt during execution of their duties, and damages have been done time and time and again, but we want to extend that. The services are extremely delayed in so many areas, in Mamelodi, Soshanguve, Region 4, Centurion, Oliven, Yevel-Oord, Monavoni. There's quite a number of areas that have had lengthy outages, both water and electricity outages, which under normal circumstances they were supposed to have been sorted out, but due to the strike, which is an illegal strike, we couldn't reach our people, and the services are extremely delayed.
Yeah, so then what becomes the message to patients who are hoping to get some kind of assistance at those facilities, Themba?
One thing I understand is that I am yet to hear anything from the union to condemn the damages that I've just mentioned now, or even because we have issued, the court has given us an order for the staff to come back to work. I'm yet to hear anything from the union to say to their members to come back to work. One other thing is that much as we understand, that things have gone up, prices, petrol and all of that, the economy in South Africa has not been doing. I'm yet to hear the union says, let's join hands and make sure that we then excite revenue in the city so that we can be able to pay people. If they have such initiatives, then I will be the first person to say, no, let our people get that. Remember, during COVID, our people got salaries. When lots and lots of South Africans lost their houses, lost their salaries, lost their jobs, and etc., etc., we kept on paying people, even bonuses during that time. So at this point in time, it is rather unreasonable for them to be wanting so much money, and then 3 months down the line, we would still even be looking for bonuses. It is high time we have unions singing with us with the same tune to say, let's teach our people to pay services. But we understand that with the socio-economic dynamics currently that we're going through, it is a challenge. Let's see how we can be able to excite revenue in the city. Then we can have those conversations afterwards.
Yeah, I hear that, Themba, but the question I was asking is those patients who need assistance from the affected clinics, what's the message from the city about whether or not they should head to these clinics for assistance or seek alternative remedies?
What they could do was that phone our local councillors to be able to get information. However, on the clinics currently are open, there's very few clinics that are not open, which we have sent our TMPD officers to be able to safeguard those, and so that people can be able to access that. In case they can't accept that, they can't access those clinics, they should just phone our 012358 9999 call center number so that they can be able to give us that information. We can send a team to make sure that our people have access to all those facilities.
Yeah, a lot has happened since the strike was actually initiated. My understanding is that upwards of 40 workers have now been suspended, with a number of others arrested. I think that figure is at 15. You know, there's two possible impacts that something like this could have. One, it could pushed the striking workers back to their posts for fear that they too may suffer the same fate. The other possible outcome, of course, is that it may reinvigorate the strike itself. In other words, entrench people's resolve, because now they feel like they're fighting for a much deeper cause. With the benefit of hindsight, and now that we're here, is this something that the city still stands by, given these possible outcomes?
Yeah, remember, we opened our book so that the union can be able to see what is the status of the city. The city is not being doing well. First of our priorities is each and every month is to make sure that our employees are being paid. Then obviously our bulk services like ESCOM, like rainwater, which we're struggling to pay because obviously, we've got arrears on that. So we have tried so many ways to make sure that our people are getting paid and to make sure that much as we pay them, we excite revenue in the city so that we can be able to pay our debtors and all those that we are trading. At this point in time, I had thought that our union would come forward and voice that we need to tighten our belts and make sure that we excite revenue in the city as such so that we can be able to pay our people. It can't be at this point in time where we've got economic crunches, where we're not doing well as the city, and then also there's this sporadic claim 5.4%. 5.4% is almost 600 million, which the city doesn't have at this point in time.
Sure. All right. Themba Fosi, thanks very much indeed for speaking to us. He's the MMC for Utilities. It appears there's just no way around the deadlock currently, which is being experienced by striking workers in Samwu. The message, though, is that most clinics in Tshwane are now operational. And if you're worried about whether or not the clinic that you usually go to for your assistance, there's a number there that hopefully we'll be able to post on our social media pages that you can contact.